Okay, we'll call this meeting to order at 4:32 p.m. of the October 8th Personnel Committee. Alders Johnson, Hinkfist, and Grant are present. Alder Galvin is excused. We'll entertain a motion to approve the agenda.
So moved.
Second.
We have a motion by Grant and a second by Hinkfist. Any discussion? Seeing none, all those in favor say aye.
Aye.
Opposed, motion carries. Item D, approval of the September 24th, 2024 minutes.
Motion to approve.
Second.
Motion by Grant, second by Hinkfist. Any discussion? Seeing none, all those in favor say aye.
Aye.
Opposed, motion carries. E, regular business. 1, for consideration with possible action on the request to fill the following positions and all subsequent vacancies resulting from internal transfers. Arborist 2 position. Any questions?
No, move to approve.
Second.
Motion by Hinkfist, second by Grant. Any discussion? Seeing none, all those in favor say aye.
Aye.
Opposed, motion carries. Item 2, for consideration with possible action on health, dental, vision, life, and disability benefits starting January 1st, 2025. Staff.
So you have a memo in your packet, which I've been told is really easy to read and understand. Sorry.
Believe it or not, Joe, I do understand.
That's good. That's
Getting
really
sure.
good. So for our benefits, we're not making any changes to vision and dental, disability or life insurance, and then also we're going to Associated Bank for flex spending and corporate health savings account. We are making a change though to our health insurance benefits, and we have Beck from M3 to help explain the changes. So Beck Krasinski from M3.
We don't need to open the floor. No. Go ahead.
Okay, excellent. All right, well, thanks so much for your time this evening. I just wanted to share a little bit more about the proposed changes to the health insurance plan that allow the city to reduce the impact on the budget this year. As stated in the memo, the city would be facing a double-digit increase had it not been for the proposed changes this evening. So the changes that we're presenting to you provide some really nice stability for your members, but also provide the opportunity for them to take greater control of their healthcare spend if they are willing to choose one of the 2 consumer-driven options. The first being the high deductible health plan that's been offered by the city for a number of years. That is an HSA eligible plan, and we've seen increasing enrollment in that plan over the years, but it has not been a plan that has been significantly incentivized. The plan that we're adding or proposing to add this year is called Surest. And Surest is a plan option that has no deductible. Instead of a deductible, there is a maximum out of pocket, and all services or prescriptions up until that maximum out of pocket are met have a copay. The copay varies based on the quality of the provider and the efficiency of care that that provider provides. And so it is a technology-based platform where members will use the app to determine, for my primary care visit, do I see a $25 provider or do I see a $90 provider? Those decisions then, of course, lead directly to costs on the health plan, but also empower your employees and their families to make choices based on quality of care first and foremost. We know that high quality care leads to reduced future healthcare costs. And so while both the high deductible plan, having members pay for all of their expenses up until their deductible is met, and the Surest plan, no deductible, but having those variable copays until the maximum out of pocket is met, really help your employees then to guide their care decisions.
How does that differ then from the PPO or the original plan? Because if you're shifting no deductible, is the out-of-pocket comparable with the copays that they're paying?
Yeah, great question. In your packet, you have a chart that looks similar to this, where all 3 plans are noted side by side. In that comparison, the copay plan is listed first, and you'll see that the deductible, the portion that the member needs to meet for expenses that are subject to deductible, is $2,250 on the single plan, $4,500 on the family plan. The maximum out of pocket is $4,500 on the single plan, so double of the deductible, and then $9,000 on the family plan. Under the Surest plan, there is no deductible, and then the maximum out of pocket is $5,500 for the single plan and $11,000 on the family plan. Couple things that I'll note. First of all, the city has very few members who meet the deductible, and so this is not a large portion of your membership that is impacted by this decision. But adding Surest gives them an additional plan design to choose from based on their own healthcare needs. We know that some folks are probably still going to choose the copay plan. Some will choose to stay in that high deductible health plan, likely because they want to continue saving in a health savings account. But Surest is another one of those options that for folks who aren't necessarily high utilizers of the health plan to begin with, but aren't comfortable with that upfront cost for all of my health care up until I've met my deductible in a high deductible plan, then that gives them an option where they know the cost of care when they seek care.
Under the high deductible health plan, how much have we done to educate people on that? And then, does the city put any money in the HSAs for the people?
We do. So each year at open enrollment, we share information about high deductible health plan and the advantages of saving in a health savings account.
Right.
We also did a communication campaign with employees this spring where we educated not only about the nature of the self-funded health plan and how the city's claims directly impact what the premiums are, but also educated about the value of saving in those health savings accounts and how a high deductible health plan works. And then I think your other question was, does the city contribute to those
Right.
plans?
How much does the city contribute?
$500 single, $1,000 on the family plan. And you should also see that noted on that health benefits comparison. The city contributes funds to a deductible reimbursement account for the copay plan and then to the health savings account on the high deductible health plan.
Do we do the HSA for all employees or just those in the high deductible plan?
Only those on the high deductible
Can only
plan
do it.
because the copay plan is not a health savings account eligible plan.
Oh, okay, good.
It's not eligible. What is the split right now? Because right now it says there would be Surest 139, 172. Are these estimates?
Yeah, those are estimates. That's assuming that 60% of the current copay plan population chooses to leave the copay plan and choose either the Surest plan, which is what you see modeled on that worksheet, or the high deductible plan, because the premiums are set the same for both the high deductible plan and the Surest plan. Your current enrollment, the copay plan, if I just do rough math here real quick, the copay plan currently has about 540 members on the copay plan, and then the current high deductible plan has about 80.
Yeah, so I think
Yeah, that makes
what we projected was, if you look at the PPO numbers that we're just looking at, it's essentially those are the ones that would be shifting to Surest, right? I don't think we moved any of the high deductible health plan.
Correct.
Yeah.
We did not move any of the high deductible health plan membership, so that 100 that you see there is the current enrollment in the high deductible plan.
Are there going to be any tools for the staff or for everybody to use to put in their medical expenses and calculate whether Surest would be better versus a high deductible? Because technically, if the city's putting money in, they have money already to cover their deductible under the high deductible health plan. Because
A portion, yes, through the health savings account.
versus them having to pay out of pocket, they can save money. So I'm just, is there going to be a tool that would be able to show them that?
Yep, so a couple things with regard to employee communication. First, upon council approval, we have prepared a benefit changes overview presentation that we would work with the city and the existing technology that the city uses to push that communication out to members. That can be done on a department and supervisor basis or on an individual employee basis so that they watch a very short video that overviews the changes. Then during open enrollment, which we are targeting for that last week of October, we've invited representatives from Surest to join the meeting for us. So they will explain the Surest program and help members with evaluating those 3 different options. And then we also have 2 different benefit hotlines that will be open, one specific to folks who have questions about Surest, and then one more general about benefits overall, which could take Surest questions as well, but would give members the opportunity to leave a voicemail with their question. Then our teams research the question and return a phone call to the member with answers to their question and the opportunity to have some dialogue then.
And where does Surest get this data? Because one of the things I just heard you say is you'll call and I want to see Dr. A,
Yes.
but Dr. B is cheaper. How are you getting that data?
So the cheaper, I just want to make sure that we're clear about this. Cheaper is what the member pays.
Right, I'm
Not
talking about
necessarily what the health plan pays.
$25
Yep.
copay
Absolutely.
versus...
Yes. So the data is based off of Center for Medicare and Medicaid Services publicly available data. So that's from all of their Medicare and Medicaid claims, but not just those publicly funded programs. It's also from all of United Healthcare's commercial book of business. Things that go into those evaluations include things like readmission rates, infection rates, repeat procedures, how many procedures a doctor performs, early diagnosis, stage of diagnosis, number of labs and diagnostics that providers run. So it's a variety of different metrics, all of which point to quality. We want to be really clear that it's about the quality of the provider, not just the cost of care. High quality leads to lower overall cost of care.
Do you see this as an industry trend, like going more towards, I guess, accountable healthcare decisions?
I would say since high deductible health plans came onto the market, I think the goal was better consumerism opportunities for members. I think what we saw is with the budgets of employers being restricted, the deductibles of high deductible health plans got higher and higher and become less accessible for members. So I think this no deductible option, but that point of sale type of I go get my oil changed, I know what I pay. I need my tires rotated, I know what I pay. I go to see my primary care provider and I have no idea what the cost of that visit is. In this model, you know what the cost of that visit is then. And so it helps folks think differently about their health care.
So there are no networks then with Surety?
It is part of United Healthcare's Choice Plus network. So members would have the same network that they have on the copay plan and the same network that they have on the high deductible plan. Also, they'll use the same pharmacy network. So continuing with Optum Rx and continuing with the same formulary and the same structure of what's included or not included on the plan.
And what's the average deductible on pharmacy?
There's no separate pharmacy deductible. Are you talking copays on the Surest
Copays.
plan? Copays on the Surest plan range between $10 for generic, and then the highest copay specialty medication is at $370.
So is that like
There-
a tiered program?
It is, yep. So $10
Three,
generic, four. $10 generic, $90 preferred brand, $120 non-preferred brand, $370 specialty, and then there is a 2.5 times copay. Two times copay for mail order and 3 times copay for retail 90-day supply. So there's still incentives to fill through mail order and then also
And it still goes to your out-of-pocket.
yeah, absolutely. Yep.
All your prescriptions.
It all goes to the out-of-pocket. The only exception to that it all goes to out-of-pocket would be if members choose to use Canna Rx, and if they choose to fill their script through that reimportation, accessing those drugs through an international source, there is no cost to the member, just as there is today. And then, it's only for those scripts that are eligible for Canna Rx and eligible on the health plan, both.
Okay, so you're assuming almost half are going to go to this new plan?
Yep. And we ran the numbers with different variations, and we feel comfortable with the risk of if it's more or less, we think we can absorb that change. I mean, I think every year depends on high cost claimants, and you can't always predict that. But for the most part, we ran some different numbers, and that's what we're projecting. What you're seeing today, in the back of the 60%.
What keeps going through my mind is how do we, because this is basically it's an insurance plan that I can go to, and if I want to go to my provider could be a $45 copay, but that's my provider. So you're going to have those issues with the employee, and then every single time you go, you got to pay a copay, and your out-of-pocket's $1,000 higher.
Yep. So one thing I can add to that is with we have partnerships with Bellin and Prevea for primary care and urgent care are $0 copays for our employees. So those are still available for PPO and the Surest plan.
And I would
Wait,
also...
wait, wait, we have another one? We have another plan outside?
Oh, yeah.
No, it's not a plan, it's just a direct.
Those are benefits within the current plan. It's a direct contract with Bellin and a direct contract with Prevea
Okay.
to provide those easy access and then lower cost points of access for your
So they
members.
wouldn't even have to look them up through Surety?
Correct. Correct.
And that's a 0?
Yeah, so that's why we feel comfortable adding this extra plan because they still have a 0 copay for primary and urgent care if they go to Bellin or Prevea. That's one thing I think helps have this.
They also continue to have virtual care services at no cost.
And I would think, and I don't want to be presumptuous, maybe someone knows more than me, but usually the relationship is between you and your primary care provider, right? If my primary care provider says I need an MRI, I don't have a relationship with that person, so I don't really care where I'm going. You know what I mean? If
Yeah,
yeah.
right.
As long as you don't disrupt my relationship with my primary care person. You know what I mean?
But now you need that MRI, and he's going to refer you to Z. You're going to look up Z and find out, oh, I can't go to Z. I need to go here because my out-of-pocket's going to be less. Because my copay.
It'd be a little effort, more effort probably in the employee's part.
Well, I think part of that.
Oh, it's a huge amount of effort on the employee's part.
Do you want to explain that?
Yeah, do you want me to talk about the app?
Yeah,
Or-
talk about that.
Yeah, so one of the things that we talked about with the benefits committee is putting together a communication, likely a video, where we're demonstrating how you can have that conversation with your provider and utilize the app to find the location for the MRI where you're going to, for example, have that MRI. And so that can be done live, real time. The providers are already doing it with medications. That's built right into their Epic system. So this is something that we anticipate the providers being more familiar with, but it's also the UHC 2 Heart designation for the premium designated providers is something that we've been communicating and the providers in our area are very familiar with because they want those 2 hearts. So these are conversations that we've had with Bellin and had with Prevea, but making sure that members understand how to utilize that app with their provider. And if that means I'm going to have my MRI at the new Bellin Surgery and Specialty Center, or if I'm going to see what the cost is at Bellin Hospital or at St. Mary's or St. Vincent's or Aurora, whatever that case might be, then that's information that your members will have access to real time in the app, and those don't change throughout the year. So providers can be added throughout the year, but their cost is the same for the year. So if my MRI was $900 and I happen to need another one, it's still $900 in the remainder of 2025.
How many people in Green Bay are on this Surety plan?
This will be the
This
first
is-
group that I'm moving to Surest. Surest has been available for several years outside of the state of Wisconsin. It is new to Wisconsin as of January 1st of 2024. So it's been in place, for this past year. We were aware of it last year, but didn't necessarily want to be the guinea pig. Now that we are hearing stories from throughout the state and having conversations with folks who are seeing success, then that's when UHC and UMR brought that to us, and we brought that as a potential solution.
And just to be clear, Surest is an option.
Right.
You could still pick.
It's one of
One of
3
the
options.
other options.
Right.
Absolutely.
Right.
Yep. So members will continue to
I'm
have
looking at
access to
ways
the
to cut
copay
the
plan,
cost.
the high deductible, or to Surest.
So what happens with the 10% that you're talking about, the 10% increase, and you don't see these numbers move that way?
Okay, and so I think Beck said that if we don't make the changes, we were looking at a 10% increase in premiums, right? Okay. So I think what it comes down to is we evaluate it every year and kind of determine where it's at. So we're hopeful that these changes, will result in, less of an increase next year based on the model from Surest.
This is cutting edge. This is cutting edge for insurance. So, just the data, just being able to get that data, and especially in Wisconsin, that's not easy to do. And then, all I would say to HR is, assuming that we adopt this, you are going to need to have something in place when they don't agree with copays. Because that's what the system says. You're going to get that feedback. I worked in insurance for 20 some years. So you're going to get it, and you're going to have some type of delivery on how you're going to, because you are a self-funded plan, and you can make those decisions separately. So I don't know how, if you've looked at the providers or the referrals, but that is where you get into the issues, especially when you've got 20% using them. 20% using them.
That's why they're asking for an HR director.
What are you talking about?
The budget.
We got one.
Well, part of it too is, we talked about the copays and we're saying you have the relationship with the doctor. If you see that your copay is on the higher end, that's a signal to you that maybe the provider isn't the best quality provider that you have. So then it's the kind of decision of stay with that provider or go to someone else for a lower cost. So
That's the argument you're going to have with them. That's my point.
Yeah.
That's my point. Not so.
Where are
This is
when you think about the industry, right, and where average healthcare premium increases are coming in, but what does that landscape look like right now?
Yeah, good question. So trend in Northeast Wisconsin right now is about 8.5% on a fully insured plan. Now, self-funded, of course, as you know, is based on you paying your claims, and so we've got quite a bit of variability in the self-funded arena. I think my smallest self-funded renewal is 4%. My largest, unfortunately, is about 25%. It depends on how you want to manage your plan and how innovative you want to be and how many additional programs you want to manage. So.
If I'm understanding this proposal correctly, if we adopt the use of Surest as a third plan, then our premium increase on the other plans would be 7%. Is that right?
I can answer that in the sense of, and without using percentages. So our PPO plan would go up about $50 per single plan per month, and about $100 for a family plan per month. So that is a big increase, but what we're...
Translate that for me, Joe, into percent, right? Because I want to get an apples to apples discussion here.
What do you mean by percentage? So
The percent increase, right? So you're getting
So
a
it's
flat rate.
Yeah.
I'm hearing a percentage here.
So a percentage is a 7% increase to the PPO plan, but then what we're doing is we're having the Surest plan and the high deductible plan be the base plan. So if you're on the PPO plan right now and you switch to Surest, your premium will go down. But if you stay with the PPO plan, it's a buy-up plan, it's probably going up, close to 20% based upon the buy-up, that being the buy-up plan. But that's to account for the value and account for the deductible and the max out-of-pocket.
Well, what's the 7% then that's being talked about in here?
Yeah, I think maybe I can explain that. The 7% is the change to the renewal premium for the copay plan.
In aggregate?
In aggregate for that copay plan. Then the Surest plan was assigned to the same rates as the high deductible plan because those are both consumer-driven plans, but just with two very different approaches to how you get there. Then the bottom portion of that document, you see the partial buy-up contribution strategy. So I'd have to do some math to get there. But the copay plan, then you notice on the far left of that contribution strategy, the contribution percentage changes for the copay plan because we're incentivizing folks to choose one of those consumer-driven approaches, but giving them a choice between the two consumer-driven approaches, and then using the copay plan as a buy-up. So there is the 7% increase to the copay plan, but then there's also a shift in the contribution strategy. Is that okay?
And the thought was, we've been looking at this for some years now where we know that our PPO plan is a rich plan, but it's also very costly to the city. So it's like, do we just continue to increase the premiums there? Or do we have an incentive for a new plan to try something different to help save the employee and employer?
Yeah, and I feel like the last few years, right, that you've come to us, our increases have been very modest
They have.
compared to what we've seen in the industry. And to me, you can't sustain that forever. I like the creativity, right, with trying to think of an alternative versus jacking up the rate. But I think the real question is going to be, how quickly our staff is willing to adapt to something.
Yeah, so we have open enrollment at the end of this month, and we're going to start, providing education as soon as next week, once it gets approved. And so we're going to give a lot, over a month of time for employees to really educate themselves on the differences in the plans.
Are you guys going to have one-on-one, I mean, do you do big group meetings when you do benefits so that,
We do. We have 8 meetings throughout the city. We also do a recorded meeting, well, a live and recorded meeting for the fire department, and then we do a live and recorded meeting that's available for all employees. So then that information is shared in addition to the benefit hotline, the benefit guide. On the enrollment platform, Bentech, we have narrated PowerPoint presentations that are live narrated, not auto-narrated. For each one of the different benefit lines, so that folks who have questions on dental and vision can watch the dental and vision video. If they have questions just about the medical plan, they don't have to watch all of the other videos. So each of those are available as well. And then we'll also have the Surest site live, so that folks can actually look up their provider. And this is what Joe and Melanie and Jill and our team all did as we were evaluating Surest, is checked out various known local providers in different locations for care, and we would expect that employees would want to do the same thing.
Yeah, and one thing I can add too is that our HR staff, our benefit specialists, our wellness administrator, they take questions and calls. When we go out to those open enrollment meetings, like at DPW and parks, they bring computers out there and laptops, and they can actually sign people up who might not have a computer at home or just aren't very tech literate or IT literate. So, I mean, and then we also tell people they can come to HR and we can work through it on laptop with them. So we provide a lot of information, a lot of opportunities to sign up online.
and what is the deductible today on the PPO?
It's the same as it is in here.
Yep. $2,250 on the single plan and $4,500 on the family plan.
That's out of pocket, so what's the deductible?
Deductible. Then the max out of pocket is $4,500 single and $9,000 family.
It's higher, I thought.
Okay.
So you guys want approval to offer these plans?
Yeah, our employee benefits party girl here really had some good questions, but
But what? What are you looking at me?
yeah, I'm looking at you.
Do you want me to offer a motion to approve?
Well, either a motion or, I mean, if there's
Yes. That's what I
anyone
was
here
just
that
doing.
wants to speak on this.
And one thing I'll add too is we're looking for a motion to approve, because when we get this locked in place for our budget, it's one last thing for us to really kind of think about in the budget meetings too, because that's kind of set in place.
Yeah, and I'll admit, I think the only thing that is just going through my head, there's 2 ways to look at it, right? And one way is this you're trying to incentivize people to go to this plan. The other way you could look at it, it's a penalty for staying on the existing one, right? And that is the only thing that just kind of weighs on me right now. I'm going to lean today towards probably supporting, pending anybody else that wants to speak, but I want to give that some more thought before council. Because you have to realize the totality of the challenge we're facing with the expense of healthcare right now, and this is at least a solution.
Yeah, I think it's a good hybrid model, so you don't, the incentive isn't go to the high deductible health plan where everything's out of pocket up to the deductible. You kind of have a different option. So that's why we feel comfortable bringing it forward.
Did you also look at high deductible plans with lower out of pockets? I mean,
Yeah.
because we're not offering the lowest, are we?
Right,
Maybe
we're-
lowest deductible and lowest out of pocket when you HDPs.
Right, we did look at that model. The only way that model produces savings is if we move everyone to a high deductible health plan and then not provide employees choice.
You couldn't give another high deductible as a third option to start moving them slowly? Meaning, what is the max deductible that you can do on a high deductible, or lowest deductible on a high deductible?
$3,200 on the family plan.
It's $3,200 on a family.
$1,650 on the single.
So that's a lot lower on your high deductible plan. Did you look at that? So that it's not so high when you're talking $10,000 out of pocket?
The challenge with that is that our claims are our claims, and the plan has to be priced higher than what would be the traditional actuarial number for a plan with that low of a deductible, simply because we know what the claims experience of the group is. And so
Yes.
we have to collect enough premium to be able to fund the claims. And so the lower we put that max out of pocket, the more responsibility the health
Got it.
plan itself has.
Got it. Yeah. I flipped it to the other side.
I get it. We've tried to think about it in all of those different scenarios.
Okay, any other questions? Anybody that wants to speak on this item? Okay, entertain a motion.
Make a motion that we approve a third option on the health plan, and with the
Probably-
promise that there will be a significant amount of training and questions and ways to follow up.
And maybe I would ask you to maybe tighten up that motion a little bit, rather than just be about the third option, adopt staff recommendation.
Okay, adopt step.
Only because it includes a lot of other things too.
That's true. You're right.
Okay, any further discussion? Seeing none, all those in favor say aye.
Aye.
Opposed, motion carries. F, informational report of routine personnel actions. Any questions? All right, our next meeting is October 22nd, 2024. Entertain a motion to adjourn.
Motion to adjourn?
Second.
We have a motion by Grant, a second by Hinkfist. All those in favor say aye.
Aye.
Opposed, motion carries.